Good afternoon. I wanted to take a few minutes and update all of you on what some of us have been seeing in the news over the last week or so. While much of the state, the county, and the world seems to be in chaos, I wanted you to know that we are working to ensure the safety of our residents and our employees. While none of these decisions that we've made have been made easily, they have been necessary to ensure that we're doing our part to slow the spread of the COVID-19 virus. We are fortunate at this point that we have had no positive cases locally. Now, while that's reassuring, that fact can and may very well change quickly. The main effort that you are seeing now by your national, your state, and your local elected officials, including me, are measures to slow the progression of the virus, not to stop it, not to cure it. We need to slow it so that our healthcare systems do not become overwhelmed with new cases. If this virus progression is not slowed, our healthcare system will become overwhelmed, and the U.S. will have no choice but to lock down like what we are seeing in some of the countries in Europe right now. So locally, we've taken the following steps. Starting this morning at the Hub, the Marion Cultural and Civic Center, the Pavilion, the Marion Carnegie Library, the Boynton Street Community Center, and the Senior Citizens Center have all been closed to the public to reduce the amount of gatherings that we have at those facilities. Now, the Senior Citizens Center will still be preparing meals on a pickup-only basis, as we've previously announced, and patrons can expect that their meals will be delivered to their vehicle upon arrival. Now, on a little bit of a personal note, I normally really prefer to stay off of social media unless I have something important to convey. This is one of those times. The partisanship and the bickering and the nonsense on social media needs to stop. This is not a partisan, a city, a state, or even a national issue. This is a worldwide event, unprecedented in our history. Let me attempt to make this issue very, very clear as to why your elected officials, including me, are taking the steps that we are. There have been so many incorrect, by the way, comparisons of this virus to the flu. Health officials estimate that the COVID-19 virus death rate in the United States is likely somewhere around 1%. The flu has a mortality rate of 0.1%. So COVID-19 has a mortality rate 10 times that of the flu. Now, in addition to this higher death rate, the coronavirus appears to be more infectious than the flu. And what that means is that normally a person that has the flu will infect 1.3 more people. According to the Journal of the American Medical Association, early estimates point that a single person with coronavirus will infect 2 to 3 people. So based on those numbers, the potential for more than double the infection rate and 10 times the death rate of the flu, the coronavirus could result in a horrific number of deaths in the United States if the mitigation efforts are not introduced immediately. Now, folks, rather than an overreaction, as it's being characterized by so many, social distancing and these other measures are simply prudent. And rather than instilling fear, they actually should bring you some sense of relief. Because these positive measures are being taken, less people may become infected, and we are working towards ensuring that our healthcare system has the capacity to handle the new cases that do come up. Now, mitigation measures like postponing conferences and conventions and canceling sporting events, having employees work from home, will bring a temporary and painful disruption to the economy, and there's no question about it. But that is a small price to pay for saving the lives of many people in our country, not to mention our town. I received an email this morning from a Casey James, who's president of the Heritage Foundation, that had some great commentary, and I'm going to borrow some of her comments. She said, "We would do well to heed the advice of the British government that offered their threatened nation under much worse circumstances during World War II to, quote, keep calm and carry on." Today, for us, carrying on means following the advice of our president and of our nation's leading healthcare professionals. It means living our lives while at the same time practicing responsible social interaction. Folks, this isn't panicking. That's doing your civic duty to help protect yourself, your family, and your neighbors. Now, there's no question that we're in some cloudy times. This moves rapidly. But in every cloud, there are some silver linings, so it's said. And there's always an opportunity to improve our condition. If you're healthy, I encourage you to consider what you can do to help a neighbor, your neighborhood kids, or maybe the town as a whole. Consider asking an elder neighbor if you can stop and shop for them and bring their groceries to them. One opportunity that the city's working on, as an example, with the Marion Unit 2 Community Unit 2 School District, is to make sure all of our school children that are out of school now are going to be fed for the next 2 weeks, and beyond that, if necessary. We will likely need help, as this endeavor is going to take a lot of resources needed to provide delivery of these meals for those that cannot make it to a pickup point. So stay tuned to the City of Marion's and the district's Facebook and website and see if there's an opportunity on how you might be able to volunteer in that important effort. But if that opportunity is not for you, let me encourage each and every one of you to do things that we all should and that we all are able to do. 1, obey the law. Obey the restrictions being placed upon you by officials. They are not being placed upon you lightly. Be kind to one another. Look for other ways to help. Do not hoard by buying everything up at the grocery store. And for crying out loud, leave some rolls of toilet paper on the shelf for somebody else. Buy gift certificates at local businesses, especially local restaurants, who are suffering and will continue to suffer. You are going to eat out again, I promise, and soon. So consider showing them your support right now by buying some gift certificates that gives them some cash flow now and that you can use later. I truly believe that this situation is an opportunity for our community to shine, to show that we care for one another, that we're not selfish, but that in our very core nature, we are selfless people. Now, as you know, the situation is fluid. It changes daily, sometimes hourly. My hope is that with these precautions that we're putting in place, as well as the statewide and national efforts, we will have 0 local cases. And we can look back on that someday and be thankful that the decisions that we made were made. Because none of these decisions are easy, and to many, they seem excessive. I hope that that's not right. I pray that those of you that think this is all absolute ridiculousness are correct. I hope you're right. Hindsight's always going to be 20/20. But all your elected officials have for the time being is making our best efforts with informed judgments to slow the progression of this virus. If we can do that, then we have done our job and lives will be saved. So we ask for your patience in the coming weeks. We ask you to do your part, and we most certainly ask you to stay at home if you're feeling any kind of sickness or symptoms of sickness. Tests are becoming more readily available, so call your doctor or your urgent care facility before you go to the ER. And for the time being, pray for your family, pray for your neighbors, pray for our community, and pray for our country. And while you're being thankful, please remember our local healthcare workers who are doing a great job, and they are so critical to all of us at this time in our history. May God bless us all. I am absolutely convinced that He does, and that He will continue to do so. With His help and with yours, we can together pull through this temporary problem with good sense and civility. And in the end, we'll all be healthier for it. Thank you.